sometimes kids go in for relatively minor surgeries like maybe a tonsillectomy or tubes or something. Something pops up and they're concerned about bleeding. And what are those concerns? How can we address it so we can minimize our risk from minor surgical procedures?
We actually, this is actually one of the most common problems we deal with in our practice. The typical story is the kid that goes to the ENT doctor because they need a tonsillectomy, and they get the blood test done before the surgery, and the blood test comes back a little abnormal, and the ENT doctor says, I can't do the surgery. You need to go to the hematologist, and that creates all kinds of worries in the family. And what often occurs is a disorder that is very, very common. The condition we're talking about is von Willebrand disease. Again, a big name. Medicine is fraught with big names. This actually refers to the physician who initially found this condition of all places in a small island off the coast of Finland. And it turns out this is actually a very common condition. So common that probably in an average Caucasian population it's about 1 in 100. But it's also common in old population. People who have African ancestry have it, Oriental have it. So it is not just the European population, but just about everybody can have it. And what this does is actually creates a slight abnormality in the blood test that is routinely done as a screening for bleeding disorders. So that's where the light bulb goes off. That's where the trigger of the investigation. But in terms of what it does to the patient, it's actually relatively minimal. That is, this is a condition which I generally define as if one bleeds more. And so it's, and the bleeding more, it's very difficult to quantify. But because we have ways to modify that, or we have a way to treat this, we generally go through a workup. We generally try to define the condition in kids that require, for instance, a surgery like tonsillectomy. Once we define that, and that's done through blood tests, what we do is we actually challenge that particular patient with a small molecules called DDAVP, which is actually a close relative to a hormone that is produced by the human body that is involved in a number of things, including how much urine we produce. But this hormone in particular can also release the factor that is missing, that is the von Willebrand factor, from where it's stored in the body. So you can, by giving this medication, we can increase the presence of this factor in the bloodstream, and essentially make the person normal for a period of time.
If you were going to have surgery, minor, and you were concerned about, what tests would you recommend someone get before the procedure?
Well, the screening tests are the so-called PT and PTT, and these are really screening tests. It's sort of like turning the key in the car, and if the car runs well, it's sort of okay. But once one of these has some slight abnormality, then what we need to do is to look at the different pieces of the car to see which one is missing. So what we do in those circumstances is we look at all the factors that we can measure in the clotting cascade, including this von Willebrand test, and this generally involves 2 or 3 specific tests that measure this condition. Now, one interesting piece of this, and I always caution my patients as I see them, is that these tests are a little bit finicky. In part because the tests themselves are finicky, but also because the simple stress of the venipuncture can actually change the level in the blood stream of some of the clotting factor, which actually, if you think about it, it's if you go to battle, if you go to be stressed and you think you're going to risk bleeding, it is actually intriguing that the body prepares itself by that adrenaline, essentially, which is the stress hormone par excellence, raises all kinds of clotting factor in the bloodstream. So we know kids don't like to be stuck. Well, a lot of adults don't, and so the simple idea, the simple stress that the venipuncture can induce some changes in what we measure that actually interfere with the diagnosis. And what that leads to is that often enough we need to repeat the test more than once in order to be sure that we're not running into a test that is normal for the wrong reasons.
How do we treat this condition?
As I said, there is this medication called DDAVP that actually raises the factor in the blood. So, and in essence, we don't, this is not, it's a genetic disease. It's transmitted in the families, and often enough a lot of people in the family have it and don't know about it. I mean, because as I said, it's a very mild bleeding disorder. Women, for instance, may have a slight increase of their menstrual flow, but how do you define that? I mean, for a woman to use 6 pads may be just normal, and what they do all the time, and it doesn't affect them in any way, shape, or form. And so because of that, often it's missed, and there may be full families where many members of the family have it, but just one member happens to have either epistaxis, nosebleeds, or a surgery, and that brings to the understanding that a particular family is affected.
If the kid had a TNA and started to bleed profusely, that would be looked for, and that could be controlled, right?
Correct. But we prefer to know ahead of time what is going on, because if that happens, what generally happens is that you then do tests, and the tests that you get are back quickly are the screening tests, and what those tests tell you is only that there is a bleeding problem, and what we need to use in those circumstances are things like fresh frozen plasma, which is a blood component that replaces clotting factors, that although blood is safe these days, we try not to use if we can avoid it. And so in knowing ahead of time, we generally can avoid to use blood product because we have this DDAVP, which is not a blood product, and we prefer to use that. Also, it's important that we were talking earlier about conditions like hemophilia that affect people's life. This is a condition where it's good to know you have it in case there is a bleeding, an accident, or a surgery. You know how to handle it, but should really not change people's life unless there are some very specific reasons. So we try not to make people out of people with Willebrand disease because they're not.